Hello, and welcome to our audience from around the world for the latest instalment of Oxford at Home, the showcase for new research and thinking coming from Oxford University during this regrettable period when we continue to be locked down in our homes away from the labs and seminar rooms where we would love to be with our students and with our colleagues. But we do have consolations and compensations, and one of them is the fantastic range of talks that we have in this series. And today we have got one that is not only an exciting piece of research, but also has a great deal of practical use for at least, I suspect, some of the audience here today. Today we're going to be hearing about 8 ways, count them, to quit smoking in 2021. Let me introduce you to our fantastic speaker for today. She is Dr. Jamie Hartmann-Boyce, Director of the Evidence-Based Healthcare DPhil Programme at Oxford, editor with the Cochrane Tobacco Addiction Group. She works in the Centre for Evidence-Based Medicine here at the University of Oxford, and her talk is based on a co-authored piece, which is available online at The Conversation, which, if you don't know, it is an extremely interesting website with an awful lot of think pieces on it. So that's something that you're welcome to go and chase up afterwards if you want to hear a little bit more. And James is going to be drawing on a research today to talk about the ways in which I think we think about addiction, you might say, and also how to overcome it. So she'll talk about 15 minutes. Please remember that whichever the channels you're on, you're welcome to send in questions, send them in via YouTube, via WeChat, via Facebook, and they will be relayed to me, and I'll pick the best and put them to Jamie afterwards. She'll speak for about a quarter of an hour, then we'll have about a quarter of an hour for Q&A. So without any further delay, Jamie, huge pleasure to host you here in Oxford at Home. Over to you.
Great, thanks so much, Rana, and thanks everyone for joining us today. So I'm going to be talking through some of the evidence we have on the most common and the most successful ways to stop smoking. My research is funded through a number of avenues, including the university itself, Cancer Research UK, the National Institutes for Health Research in Cochrane, and of course, with any research, and particularly research which relates to smoking and tobacco, it's really important to state that I don't have any financial or otherwise conflicts of interest to declare. In terms of my acknowledgements, I of course acknowledge my funders, but probably for me, the best thing about science is also the wonderful team of people I work with in the Cochrane Tobacco Addiction Group. So today I'm going to be covering my research, but that's also research I've done with them and some of the research they have led themselves. So I count myself extremely lucky to work with this great group of people. Cochrane itself is a global nonprofit organization that I work closely with, and it exists to really help people make healthcare decisions. And this can be patients, it can be carers, it can be healthcare providers. In our research, it's often also guideline developers. So sometimes we work with governments to help them decide what policies to roll out. And what we do in Cochrane is we gather and combine evidence to help people make decisions. So that means for any question we might have that relates to a healthcare intervention or a healthcare treatment, we'll go out and we'll search really systematically for all of the studies, all the evidence in that area, and we'll bring it together following a process called a systematic review. And in a systematic review, we not only combine all the data, often using statistical methods to make sense of the findings overall, but it also a really critical part of the process is that we figure out how much we can trust the studies in front of us. Unfortunately, not all research is good research, and therefore it's absolutely critical that when we're bringing this evidence together, we're thinking about how certain we are in the outcomes. How much do we trust this body of evidence? How useful is it for making decisions? Now, Cochrane reviews cover a large variety of topics, certainly not just tobacco addiction, and they are available for free to access in the UK and indeed in many areas of the world. They tend to be very thorough documents, which means they also tend to be very long. Now, usefully, there are a number of things at the start of Cochrane reviews which make them easier to access, including plain language summaries. But certainly if I'm looking at a Cochrane review quickly and I want to make a decision about something, there are some main things that I'll look for when I'm trying to think about whether or not I believe the evidence in front of me. One is simply the amount of evidence, so the number of studies and the number of participants. If we have 5 studies in 10 people each, I'm going to trust that evidence a lot less than I'm going to trust tens of studies in thousands of people. And that is because even if those small studies are beautifully conducted, totally free of bias, all research that's done in people especially has an element of chance. So the more studies we have, the more certain we can be that any effects we're seeing are due to the thing that's being tested rather than just due to chance alone. I'll also look, of course, at evidence of benefit, because if we're looking at a healthcare treatment or intervention, we are only looking at it because we think it will help. But equally important is evidence of harm. So I'm sorry about that. My phone is going crazy. And I don't know how to deal with it. It's playing the radio. I'm going to throw it out of the room. 1 second. So we also listen to the radio in my household, and my phone just decided that was the moment to play it, and I apologize for that. So going back, evidence of benefit, evidence of harm, of course, because some interventions can also cause unwanted effects, and we're always weighing up potential benefits and harms. And finally, as I mentioned before, one of the really important things is the certainty of the evidence. How much can we trust what we're looking at? And for our Cochrane reviews, that ranges from high certainty, which means that we're absolutely certain that the evidence we have is really something we can trust, and we don't think more studies are going to change our perceptions of it, to very low certainty evidence, which basically means, okay, we've looked at the research, but we're not convinced that if another study came along tomorrow, it might tell us something entirely different. So for the rest of this presentation, what I'm going to be doing is I'm going to be talking through the areas where we've done Cochrane reviews on ways to help people quit smoking. And first, what I'm going to be talking through is some of the evidence we have around behavioral support for quitting. So probably the most common and certainly the most studied form of behavioral support for quitting smoking is counseling. And for most of us, when we think of counseling, we conjure up maybe two people sitting in a room, or group counseling. Often this can be psychological in nature. And counseling for smoking cessation isn't that different. It involves talking to someone who's giving advice to you on how to quit smoking, and possibly also trying to increase your motivation to quit. Though there is quite a lot of evidence that most people who smoke do want to quit, and that therefore counseling that's focused on how to quit tends to be more effective. We have high certainty evidence that this increases the chances of quitting, and that there isn't any harm associated with this form of counseling. So this is something that can be available through healthcare providers, through the National Healthcare Service, but at the moment, it might be something that is difficult to access. And certainly if it's delivered face-to-face, pandemic constraints in many countries mean it might be harder than usual to access behavioral counseling. Now, the good news is that there's also evidence on remote forms of support. And by that, we mean support that you can get to help you quit that doesn't involve being face-to-face with someone else. So we have quite a lot of evidence on telephone counseling to help people quit smoking, and that can take the form of quit lines. So those would be, for example, toll-free numbers that you could call up. They're often provided by governments, by healthcare services that will support you in quitting, or you can sign up to services where a trained counselor will call you and support you with your quit attempt. We have evidence from almost 90 studies that helps people quit, but our certainty there is only moderate. And the reason for that is that though we have all this evidence, there's some differences in it. So some of the studies find clear evidence that this helps. Other studies find evidence that it doesn't really make much of a difference, and we don't really know why that is. And ideally with evidence, we want it to be consistent, and here all of a sudden it's not consistent and we don't know why, which is why we still want to see more studies in this area. Now, there are fewer studies, but also moderate certainty evidence that text messages can also help people quit smoking. And these programs can operate in lots of different ways. It could be, for example, a daily text message to remind you, to give you some evidence-based tips to quit. There are some more complex programs which can recognize where you are based on your phone and say, oh, she's outside during her lunch break, she's at the pub. These are common triggers for her to smoke. We're going to send her some messages right now to support her. So a lot of evidence going on in that area that's looking quite promising. But there again, we need more research. One way that we know from evidence, we have high certainty evidence that helps people quit, is offering people monetary rewards for quitting. Now, these are programs where someone who wants to quit enrolls in the program, and every so often weekly, they're tested either via their breath, their blood, or their urine to see if they're still smoking. And if they're not still smoking, they'll receive some sort of financial benefit. This might be cash, this might be vouchers. Some of these are deposit programs where people deposit their own money at the start of the intervention and get it back over time if they successfully quit. In the UK, these have primarily been rolled out for pregnant populations. In the US, sometimes we see these rolled out by employers as well, because often in the US, employers pay for health insurance, and For that reason, they have every reason to want their employees to stop smoking as soon as possible to avoid all of the cost and harm from continued smoking. But there's still quite a bit of, I suppose, despite the high certainty of evidence that these work, some societal barriers to them being used and rolled out. And that is, I think, somewhat linked to a perception that in these cases, people could have quit smoking, but they just didn't want to. And then we said we'd pay them, and then they did want to. And that, I want to be really clear, is not what is happening. Tobacco addiction is incredibly complex. There are a number of psychological, pharmacological, chemical mechanisms at play. And for whatever reason, when the craving strikes, if we think of a long-term goal, so, okay, I'm doing this because then in 30 years, I might not develop lung cancer, that does less to influence our craving in that moment than thinking about immediate short-term rewards, like I'm doing this because then tomorrow I'll be able to get my voucher. So that's something that I really personally hope we see rolled out more over the coming years. So we've talked a little bit about behavioral support. There is also a range of pharmacotherapy, so medicines available to help people quit. And probably the most well-known of those is nicotine replacement therapy. Now, nicotine itself, I think sometimes has a bad name for itself because it is, of course, the thing that makes cigarettes and smoking so addictive. But it's really important to note that the nicotine is not the thing in cigarettes that causes the harm. It doesn't cause the disease from smoking. It doesn't cause the death from smoking. And so what nicotine replacement therapy does is it gives people an essentially clean and safe way of receiving the nicotine that they might have otherwise gotten from cigarettes. We have hundreds of studies in our Cochrane review. We have over 130 with tens of thousands of participants and decades of evidence here that nicotine replacement therapy does help people quit, and no evidence that it causes serious harm. So the most common side effects are due to the way it's administered. So if you have a patch on your arm, you might have some irritation at that site, some redness, some itching. If you have a lozenge or gum, that might make your mouth feel slightly odd. And nicotine replacement therapy is widely available. It's considered an essential medication by the World Health Organization, and most people can walk into a pharmacy or a grocery store and pick some up, but it's also available on prescription. Now, there's also some evidence, interestingly, that using two forms of nicotine replacement therapy at once is better than just using one. And what I mean by that is using a patch as well as a short-acting form like a gum or lozenge can further increase the chances of quitting. I think some people are hesitant about this because there are concerns. I'm giving myself more nicotine. What if I end up using it long-term? What if I become addicted to nicotine replacement therapy? But it's really important to continually remind yourself, essentially, that the harm from smoking is from the other thing about cigarettes. So if you're relying on nicotine replacement therapy, we don't have any evidence that that causes serious harm, and we have lots of evidence that it can help you quit. Probably the most successful medication available for helping people quit smoking is called Varenicline, and its trade names, by which it's more commonly known, are Champix or Chantix. We know, however, that this medication does come with more unwanted effects than nicotine replacement therapy. So this medication tends to only be available on prescription by a doctor or healthcare provider who can make sure you're getting on with it okay. I think some people might be put off from Varenicline because of concerns about these possible harms, but that it's really important to remember that smoking as a legal thing is just uniquely deadly. And absolutely here, there's evidence that the benefit of it, how much it helps you quit smoking, outweighs any potential harm. Varenicline works by essentially stopping you from finding smoking so rewarding. So if you're addicted to smoking, when you smoke, you'll get some reward sensation, some pleasure in your brain. And Varenicline blocks those from happening. So it simply just makes cigarettes less appealing, which will help people quit. Now, next up are electronic cigarettes, which some people think of as a medication, some people think of a behavioral support. I think of as both because I think they support people in quitting through both behavioral and kind of medicine routes, especially when we're talking about e-cigarettes with nicotine. But when we think about e-cigarettes and compare them to, for example, the amount of data we have on nicotine replacement therapy, really the evidence is slim. And I apologize for that noise behind me, which is my dog getting himself comfortable. So we're really interested in the e-cigarette research. We have all these treatments that help people quit smoking, but none of them are fail-proof, and there's definitely room for improvement. And e-cigarettes really here represent a potential opportunity that lots of people are already using to help them transition off of cigarettes. So in our review here, we found moderate evidence of benefit that they help, And the reason this isn't high evidence is just that we need more studies. We don't have that many. We didn't find any evidence of serious harm in the studies that we looked at. And it's important to note that the studies we looked at were of regulated nicotine-containing electronic cigarettes. I think there's a lot of concern over events in particularly the US over the past couple of years with vaping-associated lung injuries. But it's important to note that most of those were from unregulated, tampered with products that were providing THC rather than nicotine, THC being the active ingredient in marijuana. But our certainty of harm here is low because we simply don't have that many studies, and we certainly don't have long-term follow-up because e-cigarettes haven't been around for that long. And so what we'd say when it comes to e-cigarettes is that if you don't smoke, absolutely don't start using e-cigarettes. But for people who do smoke, there is lots of compelling evidence at this point that e-cigarettes, though not harmless, are significantly less harmful, and therefore by transitioning to e-cigarettes, you can really improve your health. So coming on to the 7th and 8th, we've talked about medications, we've talked about behavioral support. Unsurprisingly, combining effective forms of both types will increase your chances of quitting even more. And probably the easiest way to do that is to go directly to a stop smoking service or to your healthcare provider, who can support you both in terms of accessing medication and in accessing effective support to help you not only take your medication and use it correctly, but also give you other behavioral techniques for quitting. And finally, I think for a lot of people, the idea of quitting smoking, though it's something they want to do, can feel distinctly daunting. And there is hopefully and helpfully some evidence that cutting down how much you smoke can help you quit eventually. So if you feel like you want to quit, but actually just going from 20 cigarettes a day to 0 isn't going to work for you, there's quite a lot of evidence that cutting down how much you smoke can then help you quit in the longer term. Intriguingly, in tobacco addiction research, there's no evidence that reducing how much you smoke without ultimately quitting comes with major health benefits. So if you are cutting down, the ultimate goal is to stop completely. But we do have evidence that cutting down will help you stop. So I've just taken us on kind of a whirlwind tour through hundreds of studies and hundreds of thousands of participants. And yet somehow smoking is still a major problem. It is a leading cause of preventable disease and death worldwide. It's also a leading cause of health inequalities. So the things that mean some groups get sicker and die earlier than others. So it's vitally essential that we continue looking for new ways to support people to quit. And so finally, evidence base for this, I'd say, is probably very low, but I think it's quite interesting. I'm always excited to see new research in this area. There is beginning to be some research suggesting that exposure to nature or exposure to pictures of nature can make you more likely to successfully quit. So I've put in a bunch of pictures of nature throughout this presentation. And there's a picture of me and my slightly disruptive dog on a walk on Christmas Day. There's lots more information available in the article on the conversation, in the groups I work with. And also I'd like to point out that because the evidence in e-cigarettes is coming out so quickly, and because there's so much uncertainty there, we've now been funded for 2 years by Cancer Research UK to update our searches for e-cigarette evidence monthly. So we're going to updating this evidence really frequently, and my colleague Dr. Linson and I are monthly talking through the evidence on e-cigarettes in a podcast. And of course, most importantly, for more information and resources, absolutely look to evidence-based ways to quit smoking because we know they can help. In the UK here, the NHS is a great place to start. So thanks very much. Apologies for the disruptions, and I look forward to taking questions.
Jamie, thank you very much indeed. And I can tell already from the stream of questions that's coming in from around the world, I think that what you've had to say clearly has a great deal of personal interest for an awful lot of people. And we'll get to some of those in just a moment. Could I just ask you to confirm this? Is this something that, as well as as a scientist, as a sort of ordinary human being, have experience of? Were you a smoker who's quit, or have you never actually taken it up yourself?
So I've never taken it up myself. I do, and I count myself lucky for that, right? Because I think whether or not we take up smoking has a lot to do with the amount of advertising and targeting that's been sent our way as a young person. But I do have close family members who do smoke and have witnessed them try to quit, try to cut down, and the challenges that come with that. So it is something that in that sense is quite personal to me.
Absolutely. And let me follow up with a question that, well, as you know, we just talked briefly beforehand, it was interesting me, but I see that Chris has written in on Facebook with exactly the same question. So I'm going to give him or her the credit for that. And Chris's question is, out of interest, has there been more or less smoking during the lockdown? Do you have any data on it? And then Chris adds, I've been finding myself, and this is Chris the smoker, I've found myself trying to smoke less, to be honest.
Yeah, that is an excellent question. So the data that I'm aware of is from the UK, and we had some research come out this past summer showing that more people had tried quitting than ever, really, this year. And absolutely, we think that is linked to lockdown and the pandemic. What's driving that, I think, is probably a combination of factors. So, of course, it's a time where we're all understandably much more concerned about our health and therefore maybe more inspired to quit smoking. But also for a lot of people who smoke, there are really powerful kind of behavioral cues. So that might mean you're more likely to go back to smoking if you're at the pub or if you're around colleagues who smoke, particularly on smoke breaks. And for many of us, lockdown has meant those opportunities also have been removed, which might help more people successfully quit.
A question that just come in actually from Anand on Facebook also, which is very much to the point actually. Do have bans on tobacco ever worked? Is it possible to ban tobacco? Some societies, of course, ban alcohol, different sort of intoxicant, but all the same. Or is that just really something that experience has shown isn't possible, isn't desirable?
I think it's something that ultimately a lot of us in tobacco control would probably like to see eventually. It's not something that is being done widely. And I suppose one of the things that really concerns me working in this area is that what we have seen are bans, total bans on e-cigarettes at the country level. And though, of course, I understand that, and we want to do everything we can to make sure we aren't kind of fueling another health crisis, I worry about the message that sends in terms of relative risks. So if we're leaving traditional cigarettes on the market and banning e-cigarettes, what message is that sending to people who smoke? So I think we absolutely know that legislative smoking bans in areas, tax changes, limiting access, plain packaging, all of those have a really important role to play. And our hope might be that decades from now, we're in an area where people don't become addicted to smoking because cigarettes aren't available, but that's not where we are yet.
I mean, you flagged up in your talk, Jamie, something that in a sense is almost a question of interpretation. If you regard vaping and e-cigarettes as being essentially a therapeutic move, you look at them one way. If you regard them basically as another form of addiction, you look at them a different way. And I'm going to give you Claire's question. This also came on Facebook, actually. This is, I mean, I'm not misrepresenting you, I think here, Claire, perhaps someone who is more inclined to think this is marketing rather than therapy. Since tobacco companies are very heavily promoting e-cigarettes, should we avoid those as a tool to quit smoking, as it confuses our message with all the marketing / brainwashing? How should we think about that?
I think it's an incredibly difficult issue, right? We absolutely know the tobacco industry has kind of waged decades of misinformation wars that have resulted in an unbelievable amount of preventable disease and death. But I also think ultimately the evidence we have, and much of it that comes from really unbiased sources, shows that e-cigarettes are considerably less harmful. And for that reason, in the people around me who smoke, who've considered switching, I have absolutely encouraged that. I think it's important to note that e-cigarettes actually first came about as a smoking cessation aid. So someone who had seen people try to quit smoking, who had family experience of it, thought surely there's a better way, a safer way to design something that's kind of like a cigarette but isn't as harmful. And that is what we have here. And I think the question isn't really whether or not they're safer than smoking, because at this point, kind of broad scientific consensus is that absolutely they are. The question is, how do we regulate them effectively so that they're being used for the right reasons and not for the wrong ones?
Let's throw in one of my own here, partly with my social historian hat on, Jerry. It just occurred to me over the years. Does anyone smoke a pipe anymore? And does any of this have any relevance to that, if so?
Yeah, great question. So I suppose some of these studies include all different sorts of combustible tobacco smoking, which would be pipe, cigars, cigarettes, but mainly what we're talking about here is cigarette smoking. And though I think pipe smoking does still happen, I think comparatively compared to cigarette smoking, it's nowhere near the same prevalence.
My very amateur understanding, there are some sort of patches like the Netherlands and Scandinavia where I think there's more of it than there is in the UK or indeed the US. I just remember two generations ago in the 50s, every college clubman going to an Ivy League school would have an open top car, a sweater, woolly sweater, a girl by his side, and a pipe, of course. Very, very different, I think.
They wouldn't be able to use those in their clubs now, you see. So I think indoor.
Quite right too. Quite right too. I'm going to give you a couple of questions here, actually, that are sort of variations on a theme which is about substitutions. So one of them is from Gillian on Facebook, which says, first of all, hope your phone's okay. And then she
Thanks.
asks, are there any dietary changes that can help with this? For instance, can you replace the sensation with food? And could I add to that a question that's come in, I think from India, from Yashwan. This is on YouTube. And does your work have comparability in the sense, can it tell you how to quit other sorts of addictions? And I guess this is to do with the kind of, the chemical reactions that come from tobacco and so on. So let me throw those two to you together to answer, Jenny.
Yeah, that's a great question. I don't think we have very much evidence on particularly kind of foods that may or may not help you quit. But what we do have some evidence of, interestingly, is that, for example, flavored e-cigarettes possibly being more helpful. Most people think, oh, if I'm quitting smoking, then I'll go to tobacco flavored e-cigarettes. And actually, a different flavor there seems to help. So I think there is some, certainly like preliminary evidence that things around tastes and flavors might have a role to play. Coming on to what it tells us about other addictions, I think, yes, in some sense, of course, there are broad comparability and lessons to be learned from other fields. But I think addiction works in different ways for different substances. And therefore, I think probably it's fair to say that when we do research, we don't want to just do research into ways to quit smoking and assume that that implies to other things. I think it absolutely makes sense to research within those areas. And there is a growing field of research, which is good to see, which acknowledges, of course, that addictions also don't exist alone. So you can easily be addicted to more than one substance. And then what do we do there? And how do we support people in quitting both?
Right. I have to say, I'm going to give you a question here from Brian Watts on YouTube, which sounds rather personally, not personally directed to you, but perhaps personal to Brian, a bit of consultancy. Could you please put the following methods in the order of effectiveness? Varenicline, vaping, patch, and gum. I'm sure that he's over there taking notes wherever you are, Brian. So I wonder if you can help him out.
Yeah, so that is actually a more complicated question than it sounds at face value. And one of the things that makes that a complicated question is the amount of uncertainty we have. So when we present estimates from studies, we present one pooled average, but then they actually sit within a range. And because with e-cigarettes, they're so new and we don't have that much evidence, that range is really wide. So kind of our top estimate for how effective e-cigarettes would be might put them above other treatments, but our bottom estimate might put them below other treatments. So if we kind of ignore e-cigarettes because we just don't have enough evidence to rank them quite yet, the latest research we have suggests that probably Varenicline is maybe slightly better or comparable to using two forms of nicotine replacement therapy. So patch and gum or patch and lozenge, as I spoke about before. But I think the evidence is pretty clear that compared to just using patch or just using lozenge, Varenicline leads to more successful quitting. And there's no evidence within, if you're only going to use one form of NRT, there's no evidence that one form is better than the other. And we definitely suggest to use two.
And here's one perhaps less about the chemical reaction, more about the psychological reaction from Helen in on Facebook. What kinds of peer pressure might work best to get your friends to quit? I think Helen's asking for a friend.
Ooh, okay. That is a great question. And I think it's something that honestly we don't have that good of a sense of, because when we talk to people who have quit smoking, certainly a lot of people say, well, my partner was insistent that I did it. And that was a huge factor that made me go ahead and do it. And for that reason, what we've done is we've tried to test this out. So if we find something that looks like it might be effective, we'll do a trial and we'll randomize one group to one thing and one group to the other. And we'll know that if we see a difference, it's because of the thing we're testing. And so there have been a number of trials of different ways of what they call partner support for smoking cessation. So essentially peer support, getting other people involved in supporting your quit attempt. And none of that evidence is particularly clear or shows us that one way works better than another, which makes me think there's probably a real individual level to it that has to do with the relationship you have with the person, with their own motivations, with how addicted they are, with how much support they have for quitting. So I'd say if there was someone in my life who I was trying to support to quit smoking, I would obviously talk to them about it. But the most important thing, I think, would be to try to get them evidence-based support in the form of medication, behavioral support, or both.
We're beginning to get to time, Joe, but there's so much coming through. I just want to put a couple more things to you as we begin to wind up. One is about the question that's coming is about reactions to your research. In particular, you know, tobacco companies don't have the world's best reputation when it comes to trying to stop people finding stuff out that hurts their business. Has there been any sense in which your research has been targeted by either corporates or other entities who are not so keen on what you're doing?
I think no matter what area of science you work in, probably there's always someone who's not that keen on what you're doing. And in some ways, one of the best things about science is that dissent, as long as it's respectful. Actually, people having different ideas and different views can be great, and is how some of the best science has been done. So I'd say probably I feel like I'm probably not prone to more of it than others, but it's something I'm always aware of, and it's a reason why I think it's important to be incredibly careful in sticking to the evidence. So when I speak about something, I speak about it based on the evidence in front of me and not based on personal opinion or funding, etc. We try to be clear, we try to be transparent, we try to be unbiased, and I try and stick to that. And therefore, so far, yeah, haven't had any major problems. Fingers crossed.
I think just to end us off here today, Jamie, could you give us a picture of, in a sense, how big or how wide or how extensive a problem this is? Because I think most of our sense as non-experts would be that compared to a generation ago, maybe 30, 40, 50 years ago, fewer people around the world smoke cigarettes, although perhaps in some countries, the country I work on is China, cigarette smoking seems to be more of a thing there, certainly, and actually increasing, unfortunately, amongst women in a way that wasn't the case previously. So how far and how widely spread is any sense, if there is one, that smoking as a whole is reducing? You know, what does the picture look like when we look at it globally?
It's a really good question. I think it's something, one of the things one is up against sometimes working in this field is the perception that somehow we've solved smoking, right? Compared to 50 years ago, it's better than it was. We don't see people smoking as much, so surely it's not that big of a problem. Unfortunately, that is not at all the case. So smoking remains, according to some estimates, still the #1 cause of preventable disease and death worldwide. And according to all estimates, it's up there in the top couple causes. And I think what's happened over time is that the people who smoke have changed, but smoking maybe hasn't changed that much. So the tobacco industry, we know when certain countries clamp down on cigarette sales, might put their attentions elsewhere and target different groups. And we also know that smoking is now really, really highly correlated with socioeconomic status. So the groups who are less advantaged in society tend to be the ones who are smoking more. That is compounded by mental health. So people with pre-existing mental health conditions are also more likely to smoke. And so I think the perception that smoking is solved is unfortunately far from being realized.
It sounds like there's plenty of work for you to be doing for some years to come, Jamie. We're very glad that we and Oxford University have you here to do it. Many thanks to our speaker today, Dr. Dr Hartmann-Boyce. And if you wanted to follow up on some of those ideas, again, a reminder that on the Conversation website, Jamie's co-authored article is there, and you can pick up thoughts from that point. We are going to be back next week for more Oxford at Home at a slightly different time. Next week, we're going to be on at 11 o'clock. Getting an early start so that you can basically get your telescopes out. So the subject is stargazing at home. It's with Dr. Becky Smethurst, known to some of you, I suspect, if you're astronomy fans, as Dr. Becky on YouTube, and she will be giving us an exclusive, but exclusive to everyone, session through any of our channels next week at 11 on Friday. And remember that you can find all of our previous talks from this season and last season of Oxford at Home via our website, just below the video, which you can find on YouTube. Thank you all for joining us again. So many of you from around the world have been building up audiences steadily, and that's a wonderful thing. And we look forward to seeing you back here online in a week's time. Thank you, Jamie, and thank you all very much for joining us today.